Every parent faces that moment, mid-diaper change, a routine task that suddenly presents a new challenge. It's a moment where your focus shifts from simply cleaning up to carefully examining your baby's delicate skin. You spot a red, irritated patch on your baby's bottom. The skin might look inflamed, bumpy, or even a little raw. It's a sight that can instantly trigger concern and a flurry of questions. It's normal to worry. It's a natural reaction to seeing your little one uncomfortable. You might find yourself wondering what you did wrong or how to make it better. But diaper rash is incredibly common, a rite of passage for most babies, really. It's one of those universal experiences that connects parents across the globe, and thankfully, very manageable. With the right knowledge and a few simple strategies, you can quickly soothe your baby's skin and prevent future flare-ups. Most babies will experience it at least once, and often several times during their diaper-wearing years. It's just a part of growing up, but you can prevent and treat it with a few simple steps. These steps are easy to incorporate into your daily routine and can make a world of difference for your baby's comfort. Understanding the causes, knowing what triggers diaper rash, is your first line of defense. By identifying the potential culprits, you can take proactive measures to protect your baby's skin. This guide will give you practical, expert-backed tips, offering clear and concise advice that you can trust to keep your baby's skin healthy and comfortable. We want to empower you with the knowledge to maintain that soft, smooth skin you love to touch. We'll break down the essentials, the must-know information, and the key products that can help. From what causes rashes, exploring the common irritants and factors that contribute to diaper rash, to the best daily habits for prevention. Establishing a consistent and gentle diaper changing routine is key. No fancy products needed. You don't need to spend a fortune on expensive creams or lotions, just smart, consistent care. A little bit of knowledge and a gentle touch can go a long way. Let's turn diaper changes into moments of care, not stress. These moments can be opportunities to connect with your baby and show them love. You're already doing great. Trust your instincts and know that you're capable of providing the best care for your little one. Let's make sure your baby's bottom stays happy and rash-free, because a happy baby means a happy parent, and that's what we're all aiming for. Diaper rash, also known as diaper dermatitis, is a common skin condition that affects infants and young children. It's something most parents will encounter at some point. At its core, it is simply inflammation of the skin in the area covered by the diaper. This inflammation can be triggered by a variety of factors, making it a complex issue to understand and manage. The appearance of diaper rash can vary. In its mildest form, it can look like a simple pinkness or redness of the skin. It might just seem like a slight flush. As the rash progresses, you might notice red spots or small bumps appearing on the skin. These spots can be isolated or clustered together. In more severe cases, the rash can escalate into blisters and even open sores. This is when the skin is significantly damaged and requires immediate attention. These severe manifestations can be quite painful for the baby. The environment within a diaper is naturally warm, creating a breeding ground for irritation. It's also consistently moist due to urine and sweat, which further weakens the skin's natural barrier. And of course, the area is constantly exposed to various irritants found in urine and stool, such as ammonia and digestive enzymes. All of these factors combine to create the perfect conditions for diaper rashes to develop and thrive. It's a challenging microclimate for a baby's delicate skin. Adding to the problem, baby skin is significantly thinner and more delicate than adult skin. This makes it inherently more vulnerable to irritation and damage from even mild exposure to these harsh conditions. It's simply less resilient. The vast majority of diaper rashes are caused by what's known as irritant dermatitis, which is essentially skin contact with the irritating substances found in urine and stool. Prolonged exposure is the biggest culprit. However, it's important to be aware that sometimes what starts as a simple rash can turn into something more complicated. Specifically, a simple rash can evolve into a yeast or bacterial infection, which requires a different and often more targeted approach to treatment. These types of infections need different treatment strategies, often involving antifungal or antibacterial creams prescribed by a pediatrician. It's crucial to remember that developing diaper rash isn't necessarily a sign of poor hygiene or neglect. Rather, it's often simply a reaction to the inherently tough and challenging environment that a diaper creates. So, what's the solution to this common problem? The key is to consistently keep the diaper area clean by gently washing it with mild soap and water. Ensure the area is thoroughly dry before putting on a fresh diaper. Patting gently is better than rubbing. And protect the skin with a barrier cream, such as one containing zinc oxide, to shield it from moisture and irritants. By changing the environment within the diaper, making it less conducive to irritation, you'll significantly change the outcome and promote healthier, happier skin for your baby. The main culprit is prolonged contact with wetness. Urine and stool break down skin fast. Friction from diapers, especially if too tight or loose, can worsen irritation. Allergies to wipes, diapers, lotions, or detergents are common triggers. Fragrances, alcohols, and dyes can set off sensitive skin. Introducing new foods, especially acidic ones, can change stool and increase rash risk. Antibiotics for baby or breastfeeding mom can disrupt bacteria, leading to yeast rashes. Watch for patterns. If a rash appears after a product change, switch back. Prevention is about minimizing wetness, friction, and irritants. Stay alert to these triggers to keep rashes at bay. When it comes to your baby's delicate skin, prevention is always better than cure. So, what's the best way to prevent diaper rash and keep your little one comfortable? The key is to keep your baby's skin consistently clean and dry. This simple principle forms the foundation of good diaper hygiene and helps to ward off potential irritations. Change diapers often. Don't underestimate the importance of frequent diaper changes. A regular changing schedule is crucial, especially in the early weeks. Aim for every 2-3 hours for newborns. Their little systems are still developing, and they tend to need changes more frequently, and always without exception, after a bowel movement. Bowel movements are particularly irritating to the skin, so prompt changing is essential to prevent rashes. Don't wait for the diaper to feel heavy. A full diaper isn't just uncomfortable. It also keeps moisture against the skin, creating a breeding ground for irritation. Act fast to remove irritants. The quicker you remove the source of irritation, the less chance it has to cause a problem. For cleaning, use warm water and a soft cloth or cotton balls. These are the gentlest options for your baby's sensitive skin. Avoid anything that could be abrasive or irritating. Skip harsh wipes. Many wipes contain chemicals and fragrances that can irritate delicate skin. If you use wipes, choose fragrance and alcohol-free options for sensitive skin. These are specially formulated to be gentle and minimize the risk of irritation. Clean gently, front to back. This is especially important for girls as it helps prevent bacteria from the anal area from spreading to the urethra and get into all the folds. Moisture and bacteria can easily hide in these creases, so be sure to clean them thoroughly. Pat the area dry. Use a soft, clean towel to gently pat the area dry. Never rub. Rubbing can irritate the skin, especially if it's already sensitive. Even a little moisture can cause problems. Dampness creates the perfect environment for bacteria and yeast to thrive, leading to diaper rash. Let your baby air dry for a few minutes when possible. This allows the skin to breathe and helps to evaporate any remaining moisture. Every diaper change is a chance to check the skin and give it gentle care. Take a moment to look for any signs of redness, irritation, or rash. Early detection is key to preventing problems from escalating. Consistency with these basics is more effective than any cream. While creams and ointments can be helpful in treating diaper rash, they're not a substitute for good hygiene practices. Simple, gentle routines keep your baby's skin healthy and rash-free. By following these simple steps, you can help keep your baby comfortable and protect their delicate skin from irritation. Fresh air is a powerful, free remedy for diaper rash. Just 15-20 minutes of diaper-free time a few times a day helps skin heal and breathe. Lay down a waterproof mat and soft towels for easy cleanup. Use tummy time or let your baby kick on their back. Both air out the skin and aid development. After cleaning or bathing, let your baby air dry before putting on a new diaper. Diaper-free time helps restore the skin's natural balance and speeds healing. For mild rashes, this is one of the best remedies. Make it a daily habit for a happier, healthier bottom. Oh, barrier creams are your baby's invisible shield against moisture and irritants. Look for zinc oxide or petroleum jelly. Both create a protective layer on the skin. Use a thin, even layer after every change if your baby is prone to rashes, or at bedtime for prevention. Don't overdo it. A little goes a long way. Always apply to clean, dry skin. If you see redness, start using barrier cream at every change. Consistency is key for both prevention and healing. Barrier creams are simple, effective, and essential for rash-free skin. Make them part of your routine for lasting protection. The right diaper makes a big difference. Choose high absorbency, well-fitting options. For disposables, look for super absorbent and fragrance-free labels. For cloth diapers, wash with mild, fragrance-free detergent and skip fabric softeners. Always run an extra rinse to remove residue. Diaper fit matters. snug but not tight with room for 2 fingers at the waist. Check leg cuffs for gentle contact, not red marks. Move up a size as your baby grows to avoid chafing and leaks. If a rash appears after switching products, go back to what worked. Every baby's skin is unique. Find what suits yours best. Pay attention to changes and adjust as needed. The right products and fit keep your baby's skin calm and clear. Most diaper rashes clear up with home care, but know when to call your pediatrician. If the rash doesn't improve after 2-3 days or gets worse, seek medical advice. Severe rashes, bright red patches, open sores, blisters, or pus need a doctor's attention. If your baby has a fever, seems very uncomfortable, or the rash is spreading, call right away. Yeast rashes look raw with red bumps or satellite spots, often in skin folds. These need antifungal cream. Don't try to treat severe or persistent rashes on your own. Your doctor can diagnose and prescribe the right treatment for fast relief. Trust your instincts. When in doubt, reach out for help. Preventing diaper rash is simple. Keep the area clean, dry, and protected. Change diapers often, clean gently, and always pat dry. Give your baby daily diaper-free time for natural healing. Use a thin layer of barrier cream to block irritants. Choose absorbent, well-fitting diapers and gentle detergents. If a rash appears, act quickly and call your doctor if it's severe or persistent. Trust your instincts and don't hesitate to seek help. Share your own tips and experiences in the comments to help other parents. If you found this guide useful, share it with friends and family. Together, we can keep babies happy, healthy, and rash-free. Check the link in description for the best rash prevention products for your newborn.